In medicine, some of the most vital information about you, like your smoking history, is absolutely critical for things like cancer screening or even planning for surgery. But here's the problem. That information is often buried deep inside a doctor's messy, free text notes. This makes it a huge challenge to use that data for research or even just to get a clear picture of a patient's health.
But what if you could teach an AI to read those notes just like an expert doctor? Well, a brand new study from researchers at Stanford and Sutter Health did just that. They wanted to see if these powerful new AI systems, called large language models, could finally be the key to unlocking this hidden treasure trove of data.
Now for us, for any student of science, technology, or medicine, this paper is more than just about some cool new tech. We're going to treat this like a critical case study. Our goal isn't just to see what they found, but to learn how to take apart academic research and analyze it with a sharp scientific eye.
Okay, first, let's get our terms straight. Everything in a hospital lives in the electronic health record, or EHR. Now, some parts of it are neat and tidy, structured fields like drop-down menus that computers can easily read. But the real story, all the rich detail about a patient's life, that's buried in the free text notes.
And this is where the proposed solution comes in. Large language models, or LLMs. You've definitely heard of these. Think Gemini, GPT-4. So the big question the study is asking is, can these AI systems, which were trained on pretty much the entire internet, actually learn to read a doctor's complicated notes and pull out specific, accurate medical facts?
So, let's pop the hood and look at the methodology. Whenever you're analyzing a research paper, this is where you have to start. This is the foundation of everything. You have to ask, was this experiment well designed? And can we actually trust the results it produced?
Looking at the study design, there are some real strengths here. For one, the researchers tested their AI on data from two totally different places: an academic hospital, Stanford, and a community hospital system, Sutter Health. That's fantastic for checking if the AI can work in different environments. On the flip side, though, there's a pretty big weakness. The data they used to train the AI came only from lung cancer patients, and that's a classic red flag we have to note. A model trained on a very specific group might not work so well for everybody else.
The researchers also had to deal with a massive problem that anyone who works with real-world data knows all too well. It's just messy. As they say right here in the paper, a patient's record is often full of contradictions. One note says former smoker, another says never smoked. It's chaotic.
So what was their solution? Something they called longitudinal smoothing. It sounds fancy, but it's actually a really elegant idea. It's basically a set of logical rules they built to clean up the patient's timeline. For instance, the system knows you can't go from being a former smoker back to being a never smoker. So it finds these impossible entries and fixes them to create one consistent, believable history for each person.
And this slide just shows it perfectly. On the left, you see the raw, messy data with all these impossible jumps. But on the right, after they apply their smoothing rules, bam! You get a clean, coherent story for each patient. It's a really powerful way to see data cleaning in action.
Okay, so the methodology seems pretty clever, even with its limitations. But the main question is still on the table. Did it actually work? Let's dive into the results and see how well this AI could actually read.
And the answer is a huge yes. I mean, just look at this chart. The older AI models, they were okay. They got it right about 82% of the time. But the new generative models like Gemini and GPT-4, they absolutely crushed it, soaring to an average accuracy of over 96%. That is a massive improvement.
And get this, the Gemini model hit an incredible 98.4% accuracy when they tested it on that totally separate data set from Sutter Health. This is so important because it suggests the model actually learned a skill, and it wasn't just memorizing the patterns from the Stanford data it trained on.
But hold on. As critical thinkers, we know 98.4% is not 100%. And often, the most interesting stuff isn't in the successes, but in the failures. So where did this incredibly powerful AI still get things wrong? So when you dig into the errors, you see the real challenges of human language. The AI got tripped up by vague phrases, like a doctor writing, "quit sometime in the 90s." It also had a hard time following complex stories, like patients who tried to quit multiple times and then relapsed. These mistakes really show us where the cutting edge of AI is right now. It's moving beyond just pulling out facts to really understanding context, and it's not quite there yet.
All right, so we have a super accurate AI that creates clean, reliable data. Great. But now we have to ask the most important question of all. So what? Who cares? How can this tech actually be used to make a difference in a patient's life?
because amazing tech is useless if it doesn't have a real-world clinical application.
And this is where the researchers really connect the dots. They use their newly cleaned up data to tackle a huge clinical problem, predicting which lung cancer survivors are at the highest risk of developing a completely new second lung cancer down the road.
And this right here illustrates the payoff brilliantly. When they plugged the AI-extracted smoking data into a risk prediction model, the results were striking. The model could clearly separate patients into a high-risk group and a low-risk group. And that difference, a 4.2% chance versus a 1.4% chance, that is a huge deal in a clinical setting.
And here's the kicker. This detailed AI-powered model was actually better at identifying high-risk patients than the current national guidelines that doctors use every day. This just proves a fundamental point. Better data can lead to better predictions, which can lead to more personalized, more effective care for patients.
Okay, let's wrap this up by boiling everything we've talked about into a simple toolkit that you can use anytime you have to analyze a research paper.
First, always interrogate the methodology. Ask who was studied and how. Like we saw, that limited patient group is a key thing to keep in mind. Second, respect the limitations. A high accuracy score is great, but looking at the errors is where you find the really interesting insights about where the tech needs to go next. And third, always demand clinical relevance. The real test for any medical AI isn't its score, but whether it can help a doctor make a better decision and help a patient live a healthier life.
So yeah, this study is a really big step forward. But it also leaves us with this huge question for the future. As we start to rely more and more on AI to read our most personal medical stories, how do we make sure that these systems aren't just processing words, but that they truly understand the complex, nuanced story of a human being?